Good evening, friends, and good morning, of course, to people in the United States. Good afternoon to the European zone, and good evening, of course, right up to Australia. So, like what Mr. Somital talked about, the first session is going to focus on to the regarding the National Digital Health Mission. And in fact, I would say out of the two schemes, I would say, which can transform the healthcare in this country. One has been the Pradhan Mantri Ayushman, Bharat Jan Arogya, Pradhan Mantri Jan Arogya Seva Yojana, and the recently announced National Digital Health Mission. And you know, so the person who is in fact in charge for both of them, of course, you can understand the kind of, he is the key person, I would say. Maybe at one stage, history is going to look at him and describe that how did he transform the healthcare in our country. So it's my proud privilege to introduce you Dr. Indu Bhushan, who actually does not need any introduction because I think everybody in this country is today aware about the role that he is playing. He is the chief executive officer for both these programs. He has been a civil servant, turned into an economist, and has an experience of more than 37 years. He has played a role in the Asian Development Bank. He's an electrical engineer by education, holds a doctorate in economics and a master's in health sciences from the Johns Hopkins University. He was recently selected for the Global Achievement Award by the Johns Hopkins University, that is his alma mater. The award is given each year to recognize the exceptional contributions of those alumni who epitomize the Johns Hopkins tradition of excellence and bring credit to the university in the international arena through their professional or humanitarian service. He was also awarded the Government of India's National Award for E-Governance of 2019-20 for excellence in government process re-engineering for digital transformation for Ayushman Bharat. I can go on and on for his biodata, but I think we would like to rather listen to him to see that what are the plans in the offing for this transformational scheme. And following this, I'm going to have three more illustrious persons about whom I'll talk to you soon after his talk. So over to you, Dr. Indu Bhushan.
Thank you. Thank you very much, Dr. Agarwal. And thank you very much for very generous and probably not fully deserved introduction. I am, of course, one of the many people who are dealing with both Ayushman Bharat PMJ and National Digital Health Mission. Not leading it, probably leadership is coming from the Honorable Prime Minister. Now, in today's 20 minutes that you've signed me, I'll discuss NDHM, National Digital Health Mission. As Dr. Mittal was saying, Mr. Somital was saying, I'll have this presentation done in two parts. I'll largely focus on how and when, but I'll also talk about what and how, or what and why. And so first, let me tell you something about National Digital Health Mission, because I recognize that there are viewers here who may not know about this mission. And then I'll come to how and when are we going to be implementing it. I'll start with what is NDHM, a National Digital Health Mission. And as some of you might know, that the journey of this actually started long time ago. And the philosophy and the mission is rooted in India's commitment to sustainable development goals, which seek to achieve universal health coverage and provide quality care to all its citizens. And this was translated into national health policy 3 years ago, and which talked about creating registries, creating digital technology and platform, and establishing federated national health information architecture and the use of metadata and data standards and electronic health records. And based on this policy, we had a group headed by Mr. J. Satyanarayana, who worked on National Health Stack and National Blueprint, Digital Health Blueprint, which was approved by the Ministry and the Niti Aayog last year. And so the National Digital Health Mission is the implementation of this blueprint, which was developed last year. The question is that what is it going to be achieving? Why, first of all, what are the guiding principles? I can, if you look at the blueprint, there are about 17 or 18 guiding principles, but I'm picking up here the 6 major principles that we have. One is that the participation in this mission is voluntary. People can participate. They can also opt out. Once having participated, they can opt out. And they can also partly participate. If they want to share some of the record, that is possible. They can withdraw the consent to share records, and they can withdraw completely. So it's entirely voluntary. Second is that we have in this mission privacy and security by design. It's not that we are going to be making a platform and then focusing on privacy and security. In the design itself, we'll ensure that all the data is secure and can be shared, can be collected, shared, and used only with the consent of the owner of the data and remains private. Third principle is inclusivity. And we know that India is a very diverse country. We have areas where there's no connectivity. We have groups which are marginalized, both socially and economically. So the aim of this mission is that all these groups who are not part of the mainstream should also benefit. And it should not be further increasing the digital divide that we have. So we have to find ways in which we can also include those who are deprived and excluded. Fourth is this seeks to provide seamless portability across systems. And for that, we have defined standards so that data doesn't remain in silos. And for storage of data, sharing of data, we have standards defined, and that will help in portability. Fifth is we are keeping the citizens at the center of this mission. And the idea is to empower them and provide information. And based on that, let them take their own decision. So it is the idea is to empower the people and the beneficiaries of this mission. And finally, it is based on a holistic concept of wellness, not only cure, but also many other things which go into the wellness. So the mission will ensure that we not only have linkage with the electronic medical records which are with the hospitals, but also all the preventive and promotive and other activities which have been done all through the life from the birth to death can be linked. People can have the records of growth monitoring, immunization, many of the preventive and public health services they've used that should also be linked so that we can provide a holistic support for healthcare. Now, question is that what is broken? What is the problem that we are planning to resolve? So we look at it from 3 angles. One is from the perspective of citizens and people, individuals. Right now, we see that citizens usually don't have access to their medical records, not all medical records, not always. They also don't have clear and enough and transparent information about facilities available, whether they're doctors, hospitals, or lab. They often don't know about the qualification of the doctors and the feedback about doctors from others. They don't have choice right now to consult doctors remotely, which came out quite clearly in the pandemic currently, when people didn't want to go to hospitals, but still they didn't have much choice. But of course, telemedicine is changing that, and this mission is going to supporting that as well. And finally, they don't have a free supply of medicines sitting there at their home. They have to visit pharmacies, and for that, they also don't have much information about quality of medicines that they're getting. But when we see it from the provider's perspective, health system perspective, they often don't have patients' medical history, and many times they are treating patients in the dark without the benefit of information about what past treatments have been provided, what kind of diagnostic tests have been done in the past, and what kind of problems or what kind of contraindication the patient might have. So the idea is that more clear and complete information is provided for to the providers, so that they can give them more effective treatment. They don't also have ability to ensure follow-up after they've done the treatment and the patient goes away, and what kind of follow-up is needed. They don't have the ability to ensure that follow-up is done. They also don't have usually the ability to consult remotely. And currently hospitals have to, for example, go through large number of hoops to conduct their business. According to our analysis, they have to take 67 clearances from different regulatory authorities, and all that can be simplified with the use of technology. Finally, policymakers, program managers, researchers usually don't have enough sufficient information on what kind of diseases are coming up, where, and how they can be prevented. They also don't have up-to-date live information about monitoring the disease patterns, and sometimes they are also making policies in the dark without that evidence coming to them on timely basis. So this mission is, of course, going to help in supporting all of these problems that I mentioned. It is going to create longitudinal health records, hopefully from birth to death. All different type of records can be linked for a person, and hopefully we can also link records of different family members, so that if there are some genetic issues coming up in families that can be traced, it will help in terms of continuum of care through interoperability. It is going to improve the ease of doing business, and we can integrate many licensing, certification, and regulatory authorities, and also claim processing for insurance. So it will help in terms of doing business for hospitals, labs, and diagnostic centers. It will also ease access to healthcare by expanding the access and reach of telemedicine. We'll have greater evidence-based planning and policies. We will have better monitoring and evaluation of interventions, better research. And finally, it is also going to spur a lot of creativity and innovation in digital health space through this platform that we are creating. And it will do to the health sector the same thing that is done by UPI in fintech sector, where a lot of innovations have come about, and life of both the banks and the consumers has become much easier. Now, what are the key building blocks? Right now, we're working on 4 building blocks. One is we are creating health IDs, which will be unique for everyone. We are creating a registry of doctors. Later on, we'll be expanding it to all other providers. We are also creating a registry of all health facilities, including hospitals, clinics, labs, and diagnostic centers. And just going back to doctors, we are not only focusing on doctors of modern medicine, but also Ayush doctors are included in this registry. And we are also linking health IDs to the personal health records and creating standards for different kind of electronic medical records, which can be linked to PHR. So these four building blocks actually have been prepared and now are being rolled out. I'll come to that in a certain part of the country on pilot, and later that they'll be expanded all over the country. There are two other major products that will come with. One is on telemedicine, other one is e-pharmacy. And on telemedicine, we have certain application. One is the government application called e-Sanjeevani, and we are onboarding another one, Swasth, which is from the private sector. And we'll be working with any other private entity which is ready to support it. And we'll be expanding the use of these two platforms soon. And we'll be working on e-pharmacy. In addition, we are also creating an e-claim platform for all hospitals to raise claims and deal with the insurance companies, where they can use the same platform and same form for raising claims for different insurance companies and different schemes, government schemes. Now, that may look a little bit abstract to some people. How will it look in terms of actual experience? So just a simulation on some part of this mission. If a patient walks up to a hospital, there will be a health ID QR code on the registration desk. The person can pull up his or her smartphone. If it doesn't have a smartphone, a regular phone through some phone connection, telephone connection. And by launching the PHR app, you can scan that QR code. Once you scan it, the hospital instantly gets the accurate information about patient, including the health ID, name, age, gender, and mobile. And there's no waiting. The registration can be done at once. And then hospital sends a consent form to patient asking whether he is ready to share his medical history, and the patient, based on that, can choose what kind of data he can share with the hospital. Sorry, excuse me. What kind of data he or she can share with the hospital, and for how long, and who will have the access. And of course, the patient can also withdraw that consent at any time if he or she thinks that that was wrongly done. Based on that, the patient, when walks into the doctor's consulting room, the doctor already has the full medical history open on his or her computer, and so the treatment is given based on full information. And finally, after the treatment, before the patient leaves the premises, patient also gets a notification that his or her medical reports are ready, and that becomes part of his personal health record. And while the record can still stay with the hospital, but the link will be with the person. So this is the vision that we have for patients once our mission is fully rolled out, and the doctor. Now, coming to the how we are going to be implementing and when. So this is the whole construct I wanted to share with you that we are planning. On the left-hand side are the facilities which will have records of the patients, and they will be in electronic format, what we call EMR. And on the right-hand side, one second, is the individual with either a smartphone or just a telephone line or through a portal. They can look at their personal health records from here. The green ones are the ones that we are hoping that private sector is going to be developing. What we are developing is the blue ones. As you can see, we are developing doctors registry and facility registry, and we are developing application which is what we call consent manager and gateways. And based on this application on the right side, um, an individual can deal with the hospitals and diagnostic centers and provide the consent for sharing of information. And this data is going to be residing closest to these hospitals or these facilities. And they can share that with the request of consent manager. And consent manager itself will not have any access to data. They'll just process the consent request, and based on that, share the consent with the either the doctor or the facility, whoever the individual authorizes to see that particular information. Now, this is the architecture that we are preparing. And as I mentioned, we have created health facility registry, DigiDoctor, and these applications for PHR and EMR web applications for hospitals. Some hospitals have, of course, their own HMIS and their own systems, but this EMR has been created for those hospitals who don't want to buy or invest into any private sector applications. Okay. Also, we've created what we call a sandbox, and sandbox is a text. Sandbox is a test environment where we are inviting private sector entities to try to integrate their systems with this mission and all the 4 modules that we have created. And so far, we've received more than close to about 400 applications, and we have given permission to about 270 applications to start integrating with the NDHM. And once that integration is complete, they can ride on this platform or this infrastructure that we have created and have access to people, doctors, and facilities, and provide their services. What kind of these applications are there? These applications relate to many areas, including telemedicine modules, which will be riding on NDHM. There will be some electronic medical records, PHR modules, which will also be helping and riding on this platform. We'll have some value-added services for health and wellness, and they can use this structure and platform. Again, some AI and ML assisted clinical decision support systems will also come up and use this mission that we have created. We'll also be having the claims processing applications, which will be part of the creativity that will be encouraging using what we have created. So all, like I was saying that about 270 such applications are already being tested, and they will go to scale once we approve them for production, and that process will continue through our sandbox. Now, in terms of way forward, this is the last slide. We are into phase 1 right now, and we have launched Health ID, PHR, DigiDoctor, Health Facility Registry, Electronic Medical Record web applications in 6 selected UTs. We've left out a couple of UTs, but these are the 6 UTs on the screen where we have started this pilot, and learning from the pilot. In 2 or 3 months' time, we'll be expanding it both geographically. We will be including more states, but also we'll be expanding the services. For example, we'll be adding telemedicine, e-pharmacy, e-claims platforms, and also we are hoping that private sector will be adding many more services using this basic infrastructure that we are creating. And then after that phase 3, it will be a full-fledged national rollout where all the various services will be included. We'll also be integrating all various national schemes, national health schemes, but also in other ministries like women and child development, whatever they do, including growth monitoring, birth and death registration being done by Ministry of Home Affairs. All that will be integrated with this mission in phase 3 all over the country. So in that sense, probably it will take about a couple of years where we see the full impact of this ambitious scheme. So our motto has been start small, think big, and scale fast. So that's the way we are proceeding with this. But if you have any questions, I'll be happy to try to answer them. Thank you very much again for inviting me. I look forward to further discussion on this issue.
Thank you, Dr. Indu Bhushan. And it has been a tremendous exercise. And on paper, it's a fantastic, I think, blueprint that has been presented. And I think everybody who has the good of the healthcare in their heart will like to see that this blueprint succeeds. But I think as a rationalist, we must also look at that this beautiful balloon, what can puncture this balloon? If we do not look at those possibilities, and I think one of the biggest thing that which I would like to kind of bring to your attention is, it is not exactly like the mobile technology taking over the landline. So the thing is that in huge parts of our country, the healthcare itself, the availability of any kind of manpower, any kind of infrastructure is just not there. So is it possible for me to build a great digital superstructure over something which is non-existent? Anyway, I'm saying so somewhere along the line, the people who are building the digital overarching structure may have to also nudge the government to create a equity-based healthcare delivery system, which is there at least available to some extent, on which this kind of a digital thing can be built. Sir, we may have to take a 2 or 3 hours session with you to have more questions and answers with you, because I don't think this is just going to, we can at the moment just ask you a symbolic question or two. But I think what is very, very important for a scheme like this is to have a feedback mechanism. It is very important for you to listen to the, people will be very, very happy to keep on saying nice things. And similarly, they'll keep on saying nice things and see to it that the scheme gets derailed. But I think it is people who will be pointing out things as to what we need to do, because we are very interested that it should happen. We are very interested now. There is a question, and which I think needs attention, that are we paying enough attention to the clinical data as compared only to the financial data? Is that the priority in the scheme as of now? Dr. Indu Bhushan. And sir, orally, otherwise, since we are running time, I would ask you if you will agree, we will organize a kind of a special, and I'll get the people, all kinds of people who have, like health informatic people, the clinicians and everybody, let them, sir, become a part of this scheme. At the moment, they are lying outside the scheme. And unless you make them a part of the scheme, this will not work. Sir.
Dr. Bhushan, you're on mute. Yeah, thanks.
Yeah, thank you very much, Dr. Agrawal. And you are absolutely right that we need to have this feedback mechanism. As you can appreciate, we are actually dealing with this problem at 3 levels. One is the IT infrastructure, and so creating the whole IT platform. Second is on the policy aspect, what kind of policy we should have. We have a policy for data security, policy for data management, privacy. we have policy for strategic control. All that we are trying to put in place because without that, the rules of the game need to be finalized. And third major area is stakeholder consultations and engagement, because a large number of stakeholders here and most, or I should say most important, but key stakeholders are states. And as Dr. Gyani had mentioned that health is a state subject, so they have to be on board. And we've been talking to states in terms of bringing them on board with this mission. So here, in terms of consultation, there is no end to it, and we want to actually be doing a lot of it. When this national digital blueprint health blueprint was prepared, at that time also intensive and extensive consultations were undertaken with a lot of stakeholders. We also have organized at least 17 or 18 different consultation meetings with various kind of stakeholders. But of course, in a country like India, 1.3 billion people, how to identify people for consultations and what kind of consultation format we should have, it's an ongoing process. And just to give you an example of, we have right now we are developing this national health data management policy, which focuses on privacy of health data. This was put up on our website for consultation for about a month. We've received more than 7,000 comments on those. And in addition, comments are actually pouring in every day. All the date has passed, but the comments have not stopped coming. And in addition, we are also getting comments from the states in that, and we'll be finalizing it. But if there is a format that you can suggest, which is more organic, more effective in terms of consultative process on various fronts, whether it is on IT structure or policy or engagement with the private sector and health sector and other stakeholders, we'll be very happy to take that into account. Like I was saying, that luckily we are starting small, and right now there are many things that we can do. Nothing is written in stone, including our IT infrastructure. It can be tweaked actually in a big way. Not only tweaked, it can be changed entirely, because we are starting with only few hundreds, few lakh, few 100,000 people, whereas ultimately we have to go to 1.3 billion people. So again, we will welcome any support that you can provide in this direction. I'll be very happy to organize a much longer and in-depth discussion on NDHM at any time, which is mutually convenient. Thanks a lot for inviting me here, and thanks a lot for all the panelists for very kind words. Dr. Chelappa, Dr. Gyani, Dr. Bilani, thanks a lot. And thanks a lot, Mr. Mittal, for inviting me.
Thank you so much.
Thank you, sir. Thank you so much. And we will be taking up your offer. There had been intense discussions on the National Digital Health Blueprint, no doubt about it. Unfortunately, so much discussion never happened on the National Digital Health Mission. And I think that's the gap. And as I said, that a lot of people who are lying outside this ambit now, we have to bring them in. And I will definitely reach you to see that how can we bring people who mean good for the, you see, let's understand one thing. There are a lot of people that the states can get on board with you without understanding what are they getting bored about. And the idea is that we want this mission to succeed. We want this to happen because this is going to be a game changer for our country. It may be the first time probably in the world anywhere that such a thing can be achieved. So thank you very much, sir, for being with us today and spending so much time.